Deputy Richard Boyd Barrett, have you views on this cluster of amendments? I'm sure you have.
Well, I have amendments in.
Yes.
We actually went to the trouble of putting amendments in, Cian, more than 20 of them. And thanks to the staff in the offices of People Before Profit and Rise, who at very short notice had to put in over 20 amendments, which are connected amendments across this grouping and other groupings, the purpose of which is to try and turn a piece of legislation which, in the form the government have put it forward, is actually a PR exercise about mandatory quarantine and is not actually a serious attempt to establish mandatory quarantine for people travelling into the country. It is an attempt by the government, under pressure from public anger over the government's failure to deal with the COVID pandemic, and particularly the dire surge that we saw in the last couple of months. It is an effort by the government to make it look as if it's doing something while actually continuing with the same failed, disastrous policy which has led to so many needless deaths and has led to our health services being overrun in the first couple of months, put enormous pressure and stress on our healthcare workers, led to tragedy and bereavement for many families, and led to very many people getting sick. So the government had to respond to that, as did some of the opposition, who said not a word about the government's failed strategy when they were pursuing it in December, but who have now become very wise after the event and are berating the government for failing to address this issue since last May, when NPHET put the advice forward. Some of us actually supported NPHET way back then and put forward policy documents, detailed policy documents, calling for mandatory quarantine as part of an alternative strategy to actually eliminate COVID-19 and try and get our society back to some sort of normality, to prevent the needless deaths, to protect our health workers and our health services. But we were siren voices, ignored and dismissed for most of that time, and it has taken the tragic events following the disastrous decisions made by the government and the silence of most of the opposition while they were making those disastrous decisions over Christmas to finally force this debate into the public, into the serious public domain. But even at that moment, the government just wants to pretend that they are doing something about it. And I have to say, Deputy Smith, it's interesting what Deputy Smith said about the situation in Ballyfermot, about vaccines not arriving, because I fear that the pretence around mandatory quarantine in this legislation may be linked to pretence about vaccine distribution as well. Because I happened to get a text just now from a woman in my area who lives in Blackrock, but whose father, who's 88, is living in Donamead, and he went down looking for his vaccine at the GP's clinic this morning. He and many other elderly people discovered the vaccines have not arrived as well. So what Deputy Smith has referred to is not an isolated example in Ballyfermot, it now appears, very alarmingly, but it's happening in GP clinics in Donamead and God knows where else. So we have announcements by the government about mandatory quarantine, announcements about vaccine, and then the reality is very, very different. And the consequences of that, of course, can be tragic. Now, I would ask Minister Donnelly on the specific issue of the vaccine, because there's a lot of elderly, vulnerable people who thought they were being vaccinated today and have now discovered the vaccines haven't arrived. Where are the vaccines? What's happening? There's clearly a pattern of GP clinics not getting vaccines for elderly people in a number of locations. God knows where else this may be happening today. Why is that happening, and what is going to be done about it to ensure that those elderly and vulnerable citizens get the vaccine and don't have to wait for weeks now in uncertainty and so on, after what's already been a very traumatising, anxiety-filled period over the last number of months, given the huge surges. Now, our amendments last Count Corla, as I said, cut across a number of groups, but essentially They seek to address the fact that the government are not imposing actual mandatory quarantine, and where the exception to mandatory quarantine is the rule in the legislation. Our amendments seek to do the very opposite, where every country and every incoming traveller will be subject to mandatory quarantine. That is because it makes utterly no sense to select out 20 countries, as the government are doing, countries from which there are probably very few people travelling into this country in any event, countries in Africa, some in Latin America, and Austria. For some reason, you know, it's just bizarre, quite honestly, right? But of course, the largest number of travellers coming into this country are from countries where we know there's high levels of COVID cases and where we know the variants are present. The United States, Europe, and many other parts of the world. So it is madness what the government are doing. It makes no sense, and actually it just shows it's a sham. That this is not actually an attempt to put in place mandatory quarantine. And I would be curious to know what's the logic. I personally think the logic is that the government don't want to upset certain economic interests. It may also be to do with the European Union's own policies. I'm not really quite sure, but I suspect it's more around certain economic interests. I mean, Deputy Murphy mentioned yesterday, no word about the US troops going through and not quarantining, waltzing around Shannon and so on, but we want to impose mandatory quarantine on just a select few countries. US troops, fine. Huge numbers of people from the UK, America, where there is variance, and so on. So it's clearly, this is not a serious attempt. And I'm interested by the Minister to hear about his conversation with the New Zealand authorities. Because you see, if you were actually talking to people in New Zealand, and if you're actually talking to the public health authorities in Australia, you would actually understand how you impose a mandatory quarantine and link it to an effective strategy to drive down COVID and where they are now living normal lives. And clearly the Minister and the government, and I have to say some of the opposition, still don't seem to quite understand this. Mandatory quarantine is not about stopping non-essential travel. It's not about quarantining non-essential travel, as some people have said. It is about stopping non-essential travel and quarantining essential travel coming in. Right? People don't seem to even understand this elementary point. You cannot go to New Zealand for any other reason than an essential reason. They just turn you around. They don't need to quarantine you. They don't need to fine you. They just turn you around. You're not allowed in. Right? That's how the system works there. So we don't need quarantine for non-essential travel into the country because there should be no non-essential travel into the country. Full stop. Anybody who arrives for non-essential reasons should just be told to turn around and go back where they came. It is essential travel that should be subject to quarantine, which should be very, very narrowly defined in exceptional circumstances. Preventing non-essential travel is the rule, whereas the government are essentially making it the exception to stop non-essential travel. The PCR test, similarly, is just meaningless in terms of the non-designated countries. Will do absolutely nothing to prevent the importation of variants and the virus. But of course, all of this also needs to be linked then to a serious public health strategy and resourcing our public health teams. And again, you see, the failure of the government to do that is manifest in this legislation, and we've tried to address it in our amendments. You see, I heard the AGSI, for example, saying, we're not qualified to organise mandatory quarantine. They're absolutely right. Do you think it's the police organising mandatory quarantine in Australia or New Zealand? No, it's public health doctors, staffed and resourced public health teams. That's who calls around to your house, not the guards. How would the guards know how to deal with mandatory quarantine or public health issues? It's ridiculous. So the AGSI are absolutely right. And people need to get into their head how under-resourced, how dysfunctional our health service is, and how that is seriously disarming our ability to deal with COVID-19, whether it's in terms of a quarantine regime in terms of travel, or whether it's in terms of eliminating community transmission and having the infrastructure on the ground, the public health infrastructure on the ground, to actually deal with any outbreaks that may still arise. And really, I think people would be shocked if they just knew the contrast. You know, the person from whom I learnt this in terms of Australia is an Irish public health doctor who worked briefly for Irish Public Health, educated here, paid, qualified through our education system, worked briefly in the Irish public health system and left, and is now in charge of infection control in Queensland and Australia, right? And I said to him, who, by the way, haven't had a COVID outbreak since June to deal with because they had one lockdown, eliminated community transmission, and now are able to open up and are living normal lives. But if there's an outbreak, they have the infrastructure to deal with it. And he was absolutely adamant that this could be done here. But I said, OK, can you explain to me the difference between the resources and the situation you have at your disposal, and this is very directly relevant to the legislation, and the situation in Ireland? And he said, well, you see, we have the resources and the authority to go to the guards, to go to the local hospital, or to go to any state agency as qualified public health people and just tell them what we need. And they give it to us. And the legislation was in place beforehand, and they had a plan before COVID ever broke out, as the WHO had asked states to do, and indeed as the Irish government had committed to do, but never did. I mean, on the first NEFIT briefing in late February of 2020, which was attended on COVID, which was attended by one representative of one Dáil office in the Houses of the Oireachtas, my office, our staff member asked, had we done drills? Had we done drills as the WHO had required? No answer. We'll email you, we'll let you know. Right? Because they hadn't done them. They hadn't done the drills. There was no preparation for this, even though the WHO had been saying you need to prepare. Okay, that's the reality of what's going on. And I asked further, I said, what would be the difference between a public health team in Australia that you have and the difference between the public health situation you would have faced if you were working in Dáil Éireann? And he said, well, I have 16 staff under me, all directly employed public health professionals. Of course, he has consultant status. He said he can ring up the equivalent of Tony Holohan. Right? He said, over here, you can't. Public health doctors can't do that. I've been talking to them. Just ring up the equivalent of Tony Holohan, their NEFIT, and just say, this is what I need, this is the situation, and so on. That doesn't happen here. I said, if you were here, how many staff would you have? He said, I wouldn't have any staff. He has 16 over there. And he can go to the local hospital if he needs more. He can tell the guards what to do. He can tell the local authority what to do because it's a public health emergency. So the public health professionals decide how it's responded to, and the resources are made available, and the legislation is already in place. That's how you deal with a pandemic, right? And what we have is a disaster compared to that, right? And the consequences have been dire. That's the truth of it, right? So, Minister, I'd be interested to hear you respond to this, but our amendments seek to actually make a mandatory quarantine a reality, to take any profiteering out of the establishment of the facilities necessary if we actually have a proper mandatory quarantine regime. And that's not just some idea. I mean, our amendments on that front have been ruled out of order But I would just like to point out they're not out of order because they're directly connected to the public health effort. Again, in Australia, any profit motivation has been removed from the public health and quarantine system established there because they found that where profit came into play, it was actually meant it was undermining the public health effort because staff were moving from one place to another, there was staff shortages, they were cutting corners and so on. Right? So our amendments seek to ensure that people will be employed directly by the health agencies, by the public bodies necessary for the effort, and they will all be under the authority of public health. That is what's necessary in order to deal with this pandemic. Sadly, I don't think the government are going to do it, and most certainly this legislation is not even a serious effort to do it, but nonetheless we will continue our campaign to have a proper response to the COVID pandemic.